Welcome to the Menopause and Cancer podcast, and welcome to our HRT After Breast Cancer series. My name is Danny Binnington. I'm the host of the Menopause and Cancer podcast and also the founder of the Menopause and Cancer not-for-profit organization. I'm excited to be right in the middle of our HRT After Breast Cancer series. Please do go back to episode 1, 2, 3, and 4 if you haven't listened to those yet. I speak to an oncologist who speaks and explains about the data, the research we have. I speak to another oncologist that explains to us how we can move forward, patients and doctors, given that the evidence we have for or against HRT is anything but perfect. I speak to doctors prescribing HRT and a doctor who's also the breast cancer patient taking HRT. And today I'm delighted to share with you another story of a brilliant patient. Tamzin is a psychotherapist and psychologist from Australia, and she shares with us on the episode why she decided to start hormone replacement therapy after her estrogen and progesterone positive breast cancer diagnosis. What's most important for me for this episode today is really just tune into Tamzin's story. Every person is so different. We all have different belief systems. We all have different worries, different hopes, and different fears. And that is why this conversation needs to be ever so individualized. And whatever you want to do or not want to do is going to be very unique to you. And so for this conversation, let's just tune into Tamzin's thinking. And I'm very grateful that she's here to share her story with us openly. So let's welcome her onto the show. Okay, Tamzin, thank you so much for joining us on the show today. So I'm sat here with the gorgeous Tamzin, a psychologist and psychotherapist from Australia, to continue our difficult conversation of how anyone would make the decision to start hormone replacement therapy after a breast cancer diagnosis. How are you today, Tamzin?
Yeah, I'm well, thank you. Thanks for having me.
So you reached out when I think I started to say we're going to look into talking about hormone replacement therapy for those who've been affected by breast cancer. And you said, I'm happy to talk about it. Tell me a little bit about where your journey started with cancer, with menopause. What came first, cancer, menopause?
So I was 47 when I was diagnosed with breast cancer, and I was pretty busy in the parenting of young children. I had a 5-year-old and a 7-year-old. And the diagnosis came as a surprise because I had been doing regular screenings and I'd had a mammogram all clear about a month prior, and it was only a lump that I by chance happened to get an ultrasonographer to put their scan over, and which resulted in a biopsy, which resulted in a diagnosis. So my regular screening didn't actually detect my cancer. So I ended up having some further screening, so an MRI, which showed the cancer much more clearly than any of the mammograms or previous ultrasounds had. And then that resulted in surgery, and I had a one-side mastectomy because my cancer was multifocal. And then when I'd recovered from that, I was started on chemotherapy, which went for about 6 months, I think, in total. And then the chemotherapy finished, and then some months after that, I went down the reconstruction journey. And when I had recovered from the reconstruction process, I was started on the aromatase inhibitors. So menopause started within the first part of the chemotherapy, and it was abrupt. I'd had regular periods and didn't have... with hindsight, I probably had some perimenopausal symptoms maybe, but it was hard to distinguish that from just being kind of tired and busy with small children and young family. So my periods were regular, and then they suddenly stopped. At first, I probably didn't notice the impact of all of that because I was busy just dealing with chemotherapy, and I was kind of making that my job to just get over or get through that and do the next bit, which was the reconstruction. So I think it hit me probably most profoundly when I started on the aromatase inhibitors, which was probably around about a year after I was diagnosed. And I got every single side effect that was listed on the packet. And it started to make sense to me that those side effects were exactly what people talked about in menopause.
So let's talk about the aromatase inhibitor side effects in a moment. Before you were diagnosed with cancer, when you were 47-year-old mummy to two relatively young children, did you ever think I need to do something about my perimenopausal symptoms, like maybe go on hormone replacement therapy? Was that on your radar, or
No,
the menopause conversation wasn't on your radar at all? It wasn't. Okay.
not on my radar at all.
Okay. So when you were going through chemotherapy, were you told your periods might stop? This is perhaps temporary menopause. What were the conversations around that?
I think the only thing that I was told is that this will probably put you into menopause. But there was no discussion about what that might mean, what that might feel like, or, how that might impact on me. It was sort of, I guess it was communicated to me as if it was some kind of secondary thing that, it's what was wanted because they wanted the kind of, ovarian suppression that came from menopause. Because my cancer was estrogen and progesterone positive. But there was no discussion about how that might feel for me or what might be the impact on my life.
And what were the conversations like when you started aromatase inhibitors?
That this would be a good thing to have because it would be a further insurance policy, against the cancer returning. So I was given some statistics, some numbers and statistics around, this being kind of the best thing for women who are in menopause after their cancer treatment.
And so what did you start feeling? You said you had every symptom that was listed. What happened to you?
It was pretty awful because, with the chemotherapy, I felt like, okay, there's some hard work to be done here. I can do hard work. And there was some kind of, chemotherapy is awful and I, hope that wouldn't wish it on anyone. But there was some kind of relief when the awfulness of chemotherapy receded. I found myself quite kind of joyful in terms of all of the things I could now do again. So even though I was still obviously impacted by the chemotherapy, I was quite, ready to do my reconstruction. And then when that was done, I felt completely, actually quite elated about the next bit because I thought I'd done all of the hardest stuff and I was ready to get on with my life, work on being fit and healthy and having some fun for myself and not kind of being wrapped up in this kind of cancer patient world. And I'd stopped work for a year, and so I was also looking at returning to work. When I started on the aromatase inhibitor, I remember saying to quite a few practitioners, my breast care nurse, my GP, my oncologist, like pretty much anyone who would listen, I said, I feel like my core has been extracted, like I've lost my mojo, like there's something about me that is just not there anymore. And I don't know, I mean, I'm not sure what people thought about that, or whether they thought I was just talking about some kind of, sexual mojo, but it wasn't just that. It included that, but it wasn't just that. I felt like I just had no kind of zest or drive, or it just felt like the core kind of me was gone. I had hoped that was just going to be a temporary side effect, so, I kept on with it. But I ended up with one side effect after another and another, and it felt like a kind of a downward sort of cascade of negative symptoms rather than a kind of getting over the negative symptoms.
And of course, you explained so beautifully that you felt it was hard work to go through chemotherapy, but there was an end in sight. I think you said it was about 6 months for
Yeah.
you, and you can get your head around that, can't you? I wonder
Yes.
if you were then told aromatase inhibitors are often prescribed for 5 to 10 years. That doesn't seem like there is an end in sight. It's ongoing. And that's a
Yeah.
very different
Yeah.
mindset one has to bring to the table, isn't it? How did that feel for you? So the contrast between the two.
Yeah, it was difficult because well, for me the plan was for 5 years. I think the kind of the possibility of 10 years that came in, sometime a little while after I had started. But even 5 years seemed, it seemed like such a long time. And people were saying, "Are you going back to work? Are you feeling, relieved? Like, are you kind of in various ways?" People were saying, "Are you better?" And I felt anything but better. I felt like, every day was a real struggle. I was tired all the time. My body just started hurting in all sorts of ways. I didn't feel very much joy. I had the hot flushes really kicked in with the aromatase inhibitor. And I was having 20 hot flushes a night. I wasn't sleeping. I was grumpy. I felt reactive. It was everything, really.
I heard quite a famous celebrity psychologist speak about her, sadly, breast cancer diagnosis. She was recently diagnosed, and I think her doctors were sort of saying to her that she might not have to have chemotherapy, and so she was feeling she maybe got away with it quite lately. It was a good type of cancer, and maybe, just surgery and radiotherapy and hormone treatment. And I think we need to rebrand this for many women, don't we? Because for the breast cancer community, what we know is the endocrine therapy part of the treatment can often be much more difficult. We know many people don't make it to the end, and they do not complete their
Yes, yeah.
treatment. Between 50 and 60% of women don't complete their treatment. Is it because they haven't had the help? Maybe. Is it because these treatments are really harsh? Probably. A combination. What happened with you? Did you finish the 5 years? Did you battle through? What happened?
I battled through for a bit. I ended up, there were kind of options in terms of managing the hot flushes, and so some of them weren't going to work for me because they weren't suitable for people who had lowish kind of blood pressure, which is me, and I didn't want anything that was going to really sedate me, or the kind of clonidine or the gabapentin weren't going to work. So I ended up on a low dose of venlafaxine, and that worked for the hot flushes, and it kind of made me probably feel a little bit less cranky or irritated at everyone. But and I probably could have continued with that, except that my body started hurting, and so I started getting, really awful musculoskeletal sort of things, which meant that it was just getting more and more difficult to exercise. And I knew that exercise and lifestyle things were going to be useful in terms of my ongoing health. But I couldn't walk. My feet were too sore, or my hips and my back. I had 10 pillows or something in bed to try and find a way to sleep that didn't hurt. And with my husband, we had lots of conversations about, is it worth it, quality of life over, kind of cancer prevention at all costs. And I think one day I essentially just cracked it and said, I'm not taking this anymore. And so I stopped, and I had an appointment with my oncologist a few weeks later, and I went and told him that I'd stopped. And he said, yes, that's okay. It's really hard. He said, take a break from everything for 6 months, and then we can think about whether you want to start on tamoxifen. So I took a break, stopped taking the aromatase inhibitor, and then a couple of months later weaned myself off the venlafaxine, that was very difficult, and started to feel really good again, and then 6 months later started on the tamoxifen, and there were some side effects, but they were nothing compared to the aromatase inhibitor. So I think I was a year and a half on the aromatase inhibitor, and then the rest of the time on the tamoxifen to make up 10 years. But my oncologist said that the aromatase inhibitor, each aromatase inhibitor year counts for 2 tamoxifen years. So in terms of the 10, I ended up with 7 years on tamoxifen and plus 3, if that makes sense. And that was absolutely manageable for me.
I think one thing I really want to touch on here is I want to really acknowledge that all of these treatment decisions must be so hard to make.
Yeah.
And any treatment decision is so hard to make as a patient, isn't it? Even going back to your earlier story of reconstruction, breast reconstruction isn't just reconstruction. There are choices and options sometimes, and we have to make decisions. Is it nipple sparing, skin sparing? If it's possible, do the doctors go to expander or straight to implant? Or, there are choices to make. But then that's one part, and every procedure comes with risks and benefits. And then bigger treatment decisions, like the one you have just been explaining, when you were just, when you decided, that's it, I'm going to stop these medications, that must come with a lot of very mixed emotions. As a psychologist or, psychotherapist, can you talk to that a little bit? Because I'm assuming, and please tell me if I'm wrong or elaborate what I'm missing, that you might be thinking this is the right decision for me, but did it also come with fear and the worry, am I making the right decision? With guilt, I've got children to look after, I'm now not doing everything I could. Talk about that a little bit with your professional and of course personal hat on. Yeah.
Well, I guess personally speaking, it was a difficult decision, and I did start to, I was thinking about how would I feel if it came back. I guess where I landed is that we never know if it's going to come back, and we don't actually know. I mean, there's probably some understanding, but I'm not kind of aware of all of that around why it comes back for some people and not for other people. I felt like I was doing all of the things that I could in terms of, staying healthy, exercising, looking after my kind of psychological or emotional health and looking after my physical health. And to me, it felt like to stay on the aromatase inhibitors would compromise that. When I spoke with my oncologist, the kind of the percentage points in the way that he explained it were that there wasn't actually a whole lot in it in terms of the difference between the aromatase inhibitor and the tamoxifen for me, for my type of cancer. It was, I can't remember the figures, but it was maybe 93 versus 94% or something like that. So for me, it felt like a no-brainer because I wasn't enjoying myself at all in the process of the aromatase inhibitor. To not take it at all. He did say to me, if you really struggle on this too, some women do stop early, or it is possible to, think about stopping early. And part of me would have loved to have stopped early, but I think I would have been left with, what if it comes back? How would I, could I live with myself? I think that, there is no guarantee that it will never come back for any of us, or there's no guarantee that we won't get another cancer or that something else won't get us. And so it's probably, there's a few times in my life when I've had to make difficult decisions where it's not an easy 100%. And so, for me, I think I consider what would be kind of 70%, because that's maybe enough when it's a difficult decision. If we wait for the 100%, then we're making another decision anyway. So for me, it doesn't have to be a 100% decision.
Thank you. Thank you for that. I also want to acknowledge your oncologist, because you were able to make an informed decision. And so I wonder if you talk about percentage, if anyone at home is listening to this who is going through a similar situation, thinking I'm really struggling on my medication, for example, is to really try and have a conversation with your medical team to help you make an informed decision. Some people do not know the benefit of their treatment. And some people don't know if the benefit is so high, it could be much higher than maybe in your case, or some people don't know that the benefit is so low. And then what would be the benefit if you switched medication? Like in your case, I feel we're not always ready to know these numbers. And I can assume, when you first put on these medications, other things are important. People might have just come out of chemotherapy. You're like frazzled. You can't think about all these things. But
Yes.
further down the line, like in your case, to make decisions, we need that information, don't we, to understand what we base our decision making on.
Yes.
So
Yeah.
Tamzin, you
And we
got to
need,
the end of your endocrine treatment. Yeah, sorry.
yes. I was just going to say we need, medical professionals who can talk with us around those, around those percentages or the benefits or those sort of thing, and who'll take the time to make it so that we understand. And I think that in my work with people who are dealing with medical issues, some of the work is kind of coaching people on how to speak with medical practitioners and how to how to advocate for themselves and find out what they need to know, and have their questions, and use the time so that it works for them.
Yeah. So if my maths is correct, by the time you finished your endocrine treatment, so the end of your tamoxifen, you were about 54, 55, something like that. So you would have gone without the cancer, beautifully transitioned probably into a menopausal state without any of the cancer treatment. Of course, the cancer treatment has put a spanner into this for you. Where were you at? Do you know where you were at? Was that on your radar, a menopause transition, whilst you were on these medications, or was that menopause still not really? What was it?
Well, I mean, it seemed pretty clear that the cancer treatment, the chemotherapy put me into menopause, and that I wasn't going to return to being non-menopausal, when my cancer treatment
Okay.
stopped because of
Okay.
my age. Maybe if I'd started, younger, that might have been the case, but I knew that I wasn't going to start getting my periods again or get my hormones back or anything like that. I know that the maths is probably a little bit confusing, but with the 6-month break and with the timing of it all, I actually finished my tamoxifen probably not quite a year ago. So last October, I think I finished it. So it's been, fairly recent. Yeah.
So, earlier you explained that you almost felt elated when you got to the end of your chemotherapy. You were ready to tackle it again and look after yourself. There was a lift in your
Yes.
demeanor. Did you feel the same after finishing the endocrine treatment?
After finishing the tamoxifen, no, I didn't feel particularly different. I was still having some hot flushes. Yeah, I was still having hot flushes. I still wasn't sleeping all that well. I mean, I'd found, because it was such a long time not being able to use any kind of hormonal treatments, I found a whole bunch of alternative things that kind of worked for me. But I felt like, I think I used to say to one of my practitioners, I feel like all of these supplements are holding me together, like as if I'm held together with sticky tape and cardboard or something like that. Like if I miss them, then I'm just going to feel awful. And I had a great naturopath who also supported me around that, who could work, really well with Western medicine practitioners. But yeah, no, I didn't feel particularly different when I stopped the tamoxifen. I just was relieved to have stopped it. My oncologist suggested that I wait 3 months. He said sometimes it takes about that long for things to kind of flush out of your system, and for you to start to feel how you're going to feel. So not to make any decisions early on. Yeah.
At what point in this whole journey did you ever start to think, I might want to even think about introducing hormones back into my body, so a low dose hormone replacement therapy, when you always kind of knew that the treatment was there to remove all of the estrogen? So when did these thoughts start for you?
Yeah. Well, I think it was partly with my kind of ongoing body pain and musculoskeletal things. So I had a hip thing that wasn't getting better, and I saw a physiotherapist who was really good with all of that kind of stuff, and she had a look at my kind of scans and my general sort of medical picture, and she was the one who started talking about the need to kind of really actively build muscle, not just be active, but actually start doing some really heavy weights to build this muscle to support my hip. And she, we were working on that, and it was helping to a degree. But the general thinking was that, the ligaments and tendons that were hurting me, in my hip, in my foot, that sort of thing, were kind of deteriorated in a similar way that my bones were deteriorating. And that was due to a lack of estrogen. And so I could kind of see myself getting less and less able to do all of the things that I loved. I felt like my world was still shrinking, even though I was off the tamoxifen, or part of that was looking towards the end of the tamoxifen. And then all through that period of time, I'd been having DEXA scans. So my bone density had been a bit osteopenic, but fairly static. And I think when I started the tamoxifen, it improved a little bit. So it was not perfect, but it was okay enough. Last January, I had a scan, and it had, pushed one of the measures into the osteoporotic range. And so I was pretty devastated by that, because I'd finished the tamoxifen. I'd been doing all of this exercise doing the kind of heavy weights for almost a year. And yet my bone density was dropping. And that was when I started to think about, well, how can I prevent this? I didn't particularly want to take the standard bone density medications, because they're not necessarily good to take at a younger age, was my understanding. They're probably fine if you're 70-something, but maybe not so good if you're 50-something. And so that's when I started to, seriously think about, would estrogen maybe be able to slow my bone loss down, or maybe even improve it? I'm not sure.
So from those thoughts in your head that you probably had with yourself initially, because it's a process, isn't it, always? When did you voice it for the first time to a family member, your husband, your oncologist? How did the thoughts turn into words, and what was the conversation like?
I'm just trying to think how I did that. I think I probably just started talking about it a little bit with my husband. I mean, but he's not kind of medically minded particularly, so I was probably just ranting to him. It's not fair. Why do I have to deal with this? Mm-hmm. I think I started speaking about it mentioned it to my oncologist, and at first he said, well, let's just wait and see, or, let's get you off the tamoxifen. We'll wait some months. And, I don't think the studies apply to people who have had tamoxifen or on tamoxifen or something like that. So initially, he was maybe a little bit more dismissive. Then I started talking to my GP and, listening to some things and reading some things, and getting a bit more interested in it. And my GP, who's fantastic, sort of facilitated a referral to a couple of people in some organisation, or in an organisation that works with women with complex health issues. And
Is that like a menopause clinic, Tamzin? Is that like a menopause clinic, basically?
It's a women's health clinic. It's not just menopause, but it's a women's health clinic. Yeah, and I was lucky enough to get a early cancellation, because a lot of those places you wait many months for appointments. But I was able to get an early cancellation to see a very experienced gynecologist who works in this organisation with women with complex health conditions. And so she's, probably pretty knowledgeable about the research around women who've had breast cancer or hormone positive cancers, and and kind of took into account my bone loss and all of those sort of things, and wrote something to my oncologist, and that prompted him being more open to that conversation when I had that with him.
How did you feel? So we hear a lot when we hear women talk in our Facebook group, or when they comment on posts on social media. Many women are really shy to even say, I'm thinking that HRT is what I want to pursue. They're worried that they might get almost online bullying. They're worried that people are going to just shut the conversation down. We hear so many stories where women say, I've waited for so long to see a menopause specialist. I've been going with all of the information. I really wanted to talk about HRT, and I was not allowed the conversation. I was just shut down. Did you have a little bit of that notion that this is what you had to do, that this would be maybe a battle against the bigger system? Or how did you feel?
Well, I did have, I guess over the years I've consulted with a few people, and I have had a few conversations with health professionals where they've just, I think many years ago, early in the journey, when I was, overwhelmed, and my GP sent me to a clinic, another clinic, not in my town, but, a couple of hours drive away. And I waited a long time to get the appointment, and a long time for the appointment on the day, and went in with all of the kind of symptoms. This is when I was on the aromatase inhibitor. And she said, oh, that's menopause, you just need to deal with it. And I was, practically in tears with that conversation, but went away with nothing. And I feel like that's happened a bit. And there was another, I think, a practitioner before I found this really wonderful one who shut the conversation down. It felt patronising, and like there wasn't the possibility of having an intelligent conversation about the risks and benefits. It was more like, no, you're not allowed that, and you shouldn't be asking. So I didn't go back. I just went to a different person.
What do you feel needs to be included to make, or have, like you explain it, the intelligent conversation about your risks and benefits? What does this intelligent conversation for you need to include? Or what did it include for you?
I guess it included my, an interest in my kind of thoughts and how I was processing the information that the health professionals were offering. So rather than a telling, it was a collaborative consultation. And, most women know when that is present, and, we mostly feel it when it's not. And, I guess practitioners can be busy or feel like they've had the same conversation with many people or something like that, and they might slip into kind of telling people mode. But I think it is really important just to slow down and see how the information that the health practitioner is offering is being received. Is there a response, rather than just a telling and take this away and off you go kind of approach. And that'll be different with each person.
Yeah. And so what happened then when you went to your oncologist, or when your menopause specialist wrote to the oncologist?
Oh, well, that was when I went to the oncologist, armed with some, some possible studies or some information. And, I know that my oncologist goes to a lot of, worldwide sort of conventions and is really interested in the latest information. So I felt like he was probably aware of some of the things that I was planning to show him. But he was really responsive, and in light of the health things that had emerged for me, particularly around my bone density, he said, yes, I think you probably should be fine to have a little bit of estrogen. And so I arranged the e-script as quickly as I could and immediately got it filled. And I suppose the other thing in terms of, people worrying about is it going to be okay or not, part of me, I'm not a medical practitioner, so I'm not sure if this is, true or not, but the way that I was thinking about it was a little bit of estrogen is not going to kill me immediately. If it is going to bring my cancer back, that's not going to happen in a week. So let's see how this goes and if it feels like a good fit for me. Because some women, will have HRT and it won't do good things for them. They won't feel good on it. And so I thought, well, let's give it a try. And let's give it a try and see what it does for my bones and see if it feels like it's a useful thing for me. So it doesn't have to be an all or nothing, will I, won't I? If I, walk past a bottle of estrogen, will my breast cancer come back or something? It seems like it's okay to try it and see how it works. And, my oncologist will keep monitoring me.
And I guess you went on a prescription of estrogen and progesterone if you still have a womb.
Yes, yes.
Is that correct? Yeah. And how long have you been taking this now? And did you feel a benefit for you? Because as you say, I think specifically in the sort of cancer community where people can't or are told they shouldn't perhaps have hormone replacement therapy, people do think everything would be better with it, but that is not always the case. We know that. And what was it like for you?
So for me, I immediately started sleeping well. And I think that was probably the progesterone, because apparently that's the thing that can make you a little bit sleepy. So I started having these amazing sleeps that were better than or as good as the sleeps that I'd had before kids. I don't think I'd slept that well since having kids, so for a long time. I started to feel pretty good, fairly immediately, like within a week or so, sleeping immediately, and then my energy just started to build. I felt pretty immediately that I had more stamina. I'd got into a bit of a routine of not doing too much in a day and making sure that there was time for rest and making sure I could, lie down on the couch at some point in the afternoon, evening, or kind of pacing myself to get through the family dinner routine so that I could rest. But I found that I just had more energy, which is what I used to be like. I could do more things and I could, just do more things for longer and have more fun doing that. So it was really good. I felt like I was coping with my work better too in terms of my energy, whether that was from the sleep or from the estrogen, I'm not sure.
I'm going to ask you a question, and I don't want to be difficult, but it's because I'm wondering how different this journey could have gone for like different people. And so, when you first talked about the bones and that you felt very deflated about the osteoporosis, and, rightly so, you've gone through all of this, you've done all of this treatment to be then left with brittle bones. And that is quite depressing. I totally agree with you. And so the estrogen was a hope for the hormone replacement therapy. You were hoping that might also prevent further bone loss, right? And you were doing all of the weights and all of the exercise and all of the nutrition anyway. I wonder if your oncologist would have maybe steered you or guided you, or in many cases pushed you down a bone transfusion, or, like you earlier said, the medication to rebuild your bones, instead of looking towards the estrogen sort of route. Did that conversation ever come up? I mean, I know nothing comes with just risks and benefits, but did that ever come up, that conversation? Was there someone trying to convince you, if it's just about the bones, let's not look towards estrogen, let's look towards other measures?
There was definitely a conversation about taking a bone, what do they call them? The kind of redensifying things. And I think the conversation that I had with my oncologist was, I talked about feeling a little bit bruised around my experience of the Arimidex and the sort of damage that it had done. And so I said to him that I was, pretty cautious around taking another kind of, medication that might end up leaving me worse off down the track for a kind of an immediate term sort of gain. So I was pretty keen to look at the long-term sort of possibility. And when we had that conversation, he referred me to someone who is, the expert, I don't know if it's the country's expert or whatever, around osteoporosis. And that person was happy for me to be taking estrogen, doing the heavy weights, and will be monitoring my bone density. And so I've recently had some bloods taken around looking at the bone turnover and all of those kind of markers, and we'll see what that shows. It takes time, so it won't be an immediate thing.
Yeah.
But I was reading about the kind of risks and benefits of the bisphosphonates and the other, I've forgotten what it's called, what class of drug it's called, but I was concerned about them, and so I expressed that concern to the oncologist.
Yeah. See, often I feel when people have to make difficult treatment decisions, and HRT after an estrogen positive breast cancer is one of those, or other treatment decisions, they're very much segmented. So there is us, the patient, with what we're influenced by, whether that's social media, whether that's people in our family, past experiences, the people around us, our thoughts, our belief system. And then there is the medical system. So we have conversations with our doctors. Often we are heard, often we're not heard. It's a mixture. We have very limited time in those situations. There's a lot of anxiety often when people speak to their oncologist. And what is always missing, I feel personally, is a bit of a hand-holding, a counseling, a coaching pathway that almost needs to be there for the patient and the doctor, so that together they can make difficult treatment decisions, because we know so many doctors are not comfortable in making the decisions your doctor made, and many patients sit alone with their thoughts, and it takes them to go and have to post as an anonymous person often into the Facebook group, because they almost don't dare to put their name to their thoughts and feelings and words.
Yes.
In a setting, if someone came to you, for example, saying, I'm making a really difficult treatment decision, I'm really worried about my future cancer, or my cancer may be coming back, there aren't great data, it's all a little bit old and rubbishy out there, but I'm still worried, I have those concerns, but I'm also worried about my future long-term bone health, heart health. How can we help people with conversation? What questions do we need to ask them so that we can help them make that process or come to a decision, whatever that decision may be?
Yeah, well, I think it takes time, and sometimes it can be useful to spend some time just sitting as if this was just the decision that we're making, and kind of inhabit, I guess, the whole experience of the decision. And so, for me, sitting with the decision of imagining that I was going to take estrogen and seeing what that might feel like, and thinking about all of the things that might be anxiety provoking or worrying for me, and all of the things that might feel a relief for me, and kind of sitting in that space for a period of time. I think that that's really useful, but also the conversations with people who will make room for the nuance around it, that it's not a one-size-fits-all decision, and people who are, who we feel confident that they are well-informed with as much recent research as is possible and can actually talk about the uncertainty of the research and help people make sense of it. Because not everyone wants to go and read 20 papers and doesn't necessarily understand the complexity of some of those things. So I think a good practitioner can help people do that if that's what they want to do. And it's okay for people if they don't want to do that. Some people don't want to make the decisions, they want to be told, and so they're the people in their care team will probably tell them the kind of on balance best practice, and that's okay if people want to do that too.
And there are so many angles one could look at the same story, isn't it? I always think if the story is sort of the ball in the middle, you could take lots of different approaches of looking at that ball from different angles, you'd see a different story. And so if you just looked at the ball and you look towards your breast cancer history and the future, we will all, after a cancer diagnosis, live with a little bit of uncertainty. Is the cancer going to spread, grow, come back, or stay away? This is the same for all of us. So you have that angle when you look at what you have decided to do. If you look at a totally different angle, for example, you could look at your bones. And we know osteoporosis is a huge problem for women, and it also leads to fractures. And in older age, we know it's a huge killer for women as well. So that's a whole other conversation. And if you just focused on that, that could be a whole huge conversation on its own. You've got both of those, right? And then, of course, it's also that we're alive and we deserve to also look at the other angle. So say I look down at this beautiful ball now, and I look down and I say, I just want to live well. I've done all of this to survive, and I just want to feel as well as I can, regardless. So this is not a risk conversation. This isn't about the cancer risk or the osteoporosis risk. This is just, I really want to feel as good as possible as well. And that's okay too, isn't it, to have that?
Yeah, I think so. And I think everyone can make the decision about what's most important for them around that. For me, it feels important to live well and to have access to joy and energy, and to be able to move my body and do the things that make me feel enlivened. Like if I didn't have those things in some shape or form, then I don't know if it would be worth it.
Tamzin, thank you so much. This was such a really, really beautiful, interesting, very reflected, I feel, conversation that I'm sure many, many people have to learn from or can learn from, doctors, patients, any other healthcare practitioners included. I think it really helps, of course, that as a background, you're a psychologist, you're a psychotherapist, so you're very used to dealing and talking about emotions and feelings and thought processes, which I think made it so good when you can explain your own thought processes. I wish you all the best of luck, Tamzin.
Thank you. And, I think, just hearing you say that, I think that, people talk about when we have these kind of adverse experiences that, maybe there's some kind of realization or recognition. And when I was in my cancer treatment, I was kind of feeling like, well, where's my realization? Like, come on, give it to me. I'm doing all of this hard work. It, didn't seem to be forthcoming, but I did, something did shift for me over the period of time of the treatment. And it was something about, having, looking after myself and having access to joy, and really noticing that, life can change really quickly, and I want what I've got left to be fantastic. I don't want to just kind of endure it. I want it to be, enlivened and rich and all of those sort of things. And so that's part of what probably kept me going with my, pursuit of how can I make it work better for me, was the learning that I took from my cancer journey. And, as everyone who's experienced cancer or cancer treatment knows, you can feel so terrible that it makes it important to kind of celebrate feeling better from that.
I had lots and lots of hours of counselling and therapy, and that came up a lot for me as well, Tamzin, in my own conversations with my own therapists and my own counsellors. And I think, in all honesty, that went back to even before I was diagnosed with cancer. The feeling I shouldn't have too much. We shouldn't have more money than my friends, because I don't want anyone feel that they're like worse off. The feeling that so many people have so many difficulties in life, and I seem to have a very lovely and easy childhood and teenage years, and that constant feeling that maybe you shouldn't have too much, you shouldn't be too happy. And yeah, and it was for me also a really a wake-up call, and it felt beautiful to think, oh my gosh, of course we deserve it all, and everyone does. And I worked very hard towards it every single day to feel
Yes.
good. And sometimes you run out of energy and you need a little bit of help to feel good as well, right? We deserve all the help and support along the way, whether that's
Yeah.
medical, whether that's friendships, whether that's love and nourishment, and our own compassion towards acknowledging that joy for ourselves. Yeah, truly, that's lovely. Thank you for sharing that. So for anyone listening today, we hope that Tamzin's story has helped you a little bit understand what a thought process could be like for someone who had to make a difficult treatment decision. And we wish you all the best of luck exploring yours. What are your challenges? What are your worries? What are your thought processes? And most importantly, where can you take them? I think sometimes we sit with these ginormous thoughts in our little heads for so long on our own. It's really good to take them to people that can help us make informed decisions. And I really hope that you will find someone that can help you make those decisions. Tamzin, it's late for you in Australia. Huge thank you from me over here in the UK today. It's lovely. Our lives have brought us together. And thank you for joining us for this series on HRT after breast cancer.
Yeah, thanks so much for having me. And it's been really great to talk with you. And I've been following and enjoying your podcast. So it's so lovely that you can share all of this with so many people who might benefit.
Thank you so much to Tamzin for recording this truthful and honest and wonderful podcast episode for our HRT After Breast Cancer series with me. When we step away from thinking you're right, you're wrong, I agree or I disagree, you should have HRT after breast cancer or you should never consider HRT after breast cancer, when we truly just tune into the person that is in front of us rather than opinions, then I think we can all move into a much more non-judgmental space. In this conversation today, listening to Tamzin, when you really hear what her thought processes are, and we can leave aside all of the judging, all of the opinions, then it becomes so clear that each patient really deserves to be supported. And whatever the person wants to do with their life, with their future, I feel they should have access and they should have opportunities and options to navigating cancer survivorship in the best way they feel that is right for them. And I'm really glad that Tamzin shared her ups and downs so honestly with us and her thought processes, so that we can all start to really relate a little bit, whether you are a healthcare professional or another patient. I hope this conversation has been really, really helpful for you. And I can't wait to bring more conversations onto the mini-series for you next week, because one thing we know, HRT after breast cancer is no one thing. It's not just estrogen and progesterone replacement therapy. Next week on the podcast, I also want to speak to a young breast cancer survivor who has decided to go on testosterone pellet implants whilst she's on an aromatase inhibitor, because what I know is menopause after breast cancer can be very, very many different things. And with that, I'm going to enjoy recording the next episode, and I'll see you then.